Tonight in Your Health, an uncertain or unclear diagnosis can sometimes be just as disheartening as learning about a confirmed medical condition. At Midstate Medical Center in Meriden, patients with the potential of having Parkinson's disease can now have a test that will confirm or dismiss a diagnosis. Channel 3's Irene O'Connor shows us how it works.
Patients with Parkinson's disease have reduced supplies of dopamine within the brain, and that leads to the symptoms of poor mobility, tremors.
Dr. Holly Dye at Midstate Medical Center says with this new test, called a DAT scan, a patient is injected with a tiny bit of radiation. Then their brain is scanned, taking images of the brain's function
That tell us something about the distribution of dopamine supplies within the brain. Typically, in a normal patient, you would see a symmetric and even distribution, an equal distribution of activity in those areas of the brain, right to left.
Dr. Dye says the tricky part about reading scans of patients with potential Parkinson's is every brain scan can look different.
You'll begin to see an asymmetry between the right and left sides of the brain. Now, as time goes on, you may begin to see a symmetric loss of dopamine.
The test can also see if the patient would ultimately benefit from dopamine injections.
In patients where the symptoms are unclear, it can sometimes take years in order to make an accurate diagnosis. So what this test can do is potentially diagnose a Parkinsonian syndrome in a patient earlier than you might make it clinically.
Dr. Dye tells us the test is covered by Medicare, and many private insurance companies are paying for the test, but you'll want to check with yours to be sure. With Your Health, I'm Irene O'Connor, Channel 3 Eyewitness News.